The sign the recession is hitting hard is in North Carolina. Okay, it's a state hit hard by the drop in manufacturing, and that's having a big spillover into the healthcare system. Doctors' offices, emergency rooms, overrun by patients who've lost their medical insurance but need help. Okay, there's a big fear that that kind of problem will spread fast as we close on President Barack Obama's 100th day in office, just a week away. We're talking about fixing the healthcare crisis right now. It is indeed a crisis, and with more unemployed Americans, it is getting worse. Jonathan Cohen, senior editor of the New Republic, and wrote Sick, the Untold Story of America's Healthcare System, Healthcare Crisis, and the People Who Pay the Price. And Michael Cannon is director of the Cato Institute's Health Policy Studies and co-author of Healthy Competition, What's Holding Back Healthcare and How We Free It. Jonathan, let me start with you. I believe in this country. I believe this country has a soul. North Carolina is a microcosm right now. 20% of folks there don't have health insurance. We are still tied where Americans, the worst thing happens to them, they lose their job, they lose their health care. Something has got to give here. What do we do, sir?
Well, this is pretty simple, actually. We've been talking about this for generations. We're the only country in the world that doesn't say to everybody who lives here, you are guaranteed health insurance, no matter what happens to you, no matter how much money you make, no matter if you lose your job. And it's about time we took that plunge. We need to have universal health insurance. We need to reform the healthcare so that everybody is guaranteed access to healthcare no matter what happens to them.
Michael, in your view, can a system like that work?
There's no such thing as that sort of guarantee. The countries that say that we guarantee health care to everybody actually don't guarantee health care to everyone. There are patients in the UK, patients in Canada, patients in all other countries who have to wait for this guaranteed care, and a lot of times they wait in pain. Now, we have a serious uninsured problem here in the United States, but the biggest reason for that is because we've turned to government to manage our healthcare sector. An estimated 14,000 Americans lose their employer-sponsored health insurance every day. That's the government's fault because the government created this insane system where your health insurance is tied to your employment.
And Michael, you have a solution to this as well.
Well, there are a number of things that we have to do. One of them is to level the playing field between employer-sponsored insurance and insurance that you buy on your own so that people can buy insurance that doesn't disappear when their job disappears. I mean, only government could create a system that's so cruel that you lose your health insurance at the very moment you lose your job.
Right, Jonathan, I wanted to pick up on that because you had said that one of the things about this recession may be a silver lining, that the middle class sees that they're vulnerable and therefore they may be more receptive to health care reform. But going back to sort of what Michael said, doesn't this really underscore the point that an employer-based health care system doesn't work? Don't we need to go down the road of health care reform where we give the tax benefits to consumers? Let consumers shop around for health care, not go through your employer. That way, wherever you work, whether you work or not, you don't have to worry about losing your health care because it isn't tied to your job.
Well, look, I think choice is fantastic. I'm all in favor of giving as many people as possible a choice. What Michael doesn't tell you is that right now, most people don't have a choice. Look, if you're with your employer, you're right. You have to choose what your employer picks. And if you don't have insurance through an employer, chances are you probably can't get insurance at all. It may be too expensive for you because if you buy insurance on the open market, it's priced outrageously. And if you have a pre-existing condition, you have diabetes, you have cancer, you won't be able to buy coverage. Now, what Michael is saying is that this is all the government's fault. Only in America could you look at a system that doesn't even have government-run health insurance and say, aha, it's the government's fault that we
let me weigh in on a couple things.
Well, Jonathan, you can't ignore it's bad enough that the government created this employment-based health insurance system, but then to say that, oh, these problems that the government created, they're actually the fault of the market. To say that it's not the government that's throwing all these people out of their health insurance when they get sick, that's just dishonest.
Well, now, wait a minute. Let's walk this back two steps. No, let's walk this back two steps. I'm sorry. This is historical.
I'm sorry. Actually, you know,
the government did not create the employers.
Sir, this is not your show. You're a guest. We love having you here, but please, Dennis has
You're doing a great job. But let me point out a couple things. First of all, I don't think government created the current healthcare system. Employers, when the government froze wages and prices in the Depression, I believe, employers came in and said, hey, the way we're going to be able to get across a wage increase that we're not allowed to is to start offering healthcare. Now, companies do provide health care.
That was the government that created those wage and price
If I could please
freezes,
speak,
and the government cemented that into place with a tax freeze.
Feisty guests tonight.
Companies provide health care insurance for something like, what is it, 260 million Americans? We got 40 million uninsured.
180.
So why can't we rifle a shot into the 40, have the government create the biggest HMO in the world and offer discounts because they have so many customers? No problem. Why do we have to overhaul the entire health care system and change it for everyone?
That's not a bad
Well,
idea.
now,
I like that.
wait a minute. If you want to do that,
Well,
if you want
we
to
need to
leave
change the
employer
healthcare
system
system.
insurance, if you
One
want
at
to
a
leave
time,
employer
Jonathan first.
insurance as it is, and then have the government offer
Because it's
insurance to
not
everyone else, great.
working.
You've just described. No, that's just you've just. If you want to just have the government offer insurance to everybody who doesn't have it, and let employers insurance as it is exist, well, great. You've just described the plan that's going through Congress right now. That's the idea.
Isn't Obama's folks talking about taxing the health care benefits that I receive from my employer right now, making me pay new taxes I've never had to pay on it before?
Well, there is discussion.
The
in
plan
yeah.
that Jonathan is talking about that's moving through Congress right now.
Question, or are you not going to let me answer the question?
Well, you
There's
haven't been letting
some
anyone else
discussion.
answer anything, so maybe you ought to slow down a little bit, my friend.
I'm trying to get my word in edgewise here.
All right,
Look,
guys.
and there are people in Washington talking about if you want to pay for universal coverage, you have to find the money somewhere. Some people would say you should tax some health benefits for some people. Usually what they're talking about are the very high income earners and saying we will tax those part of those health benefits and just the gold-plated plans. But look, I mean, that's one option on the table. There are other options. We could just do it through a straight tax, have a progressive income tax if you want, whatever you want to come up with.
Okay, Michelle,
but there does have to be
you're
some
talking about-
Guys, excuse us 1 second. Appreciate it. Michelle, I think we all agree that basically something's got to give here.
Right.
The system's wrong. Can we all agree on that? It's fair to say
yeah.
that the system's wrong.
We need to do something.
So what's the game plan?
But it comes down, the problem is the Obama plan requires higher taxes. There's really no way to get, under this plan, in my opinion, to get prices down. We've got to get health care costs down. And unless you really fundamentally reform the system, all you're going to do is saddle the system with more costs that have to be paid through higher taxes without having really any hope that because competition is being introduced into the system, because, for example, people are actually shopping for medical care, looking to see how much doctors charge for services and actually making some of the decisions that we actually don't do a lot of due diligence on now. Unless you do that, you're not going to really get health care costs down. So you have a system that is becoming more inclusive, but the costs are so burdensome and really saddle this economy.
And it would require demanding more transparency from the providers themselves to actually understand what it is that we're paying for.
You want providers to be competing with each other. You want, for example, doctors to be offering, not that of course you're going to be shopping by quality, that's on the medical side so important, but for example, insurance, you'd like people to be able to shop for which health insurance they want so that providers will really be looking to come up with the most attractive plans.
I'm not sure that shopping around is what's going to... Here's one thing that I don't understand. We always think that once we provide universal health care insurance for everyone, that costs will go down. Unlike in other technology, in the healthcare market, the more people you cover, the more coverage you provide, costs go up because we take more drugs. We weren't taking as many before. Now we take more prescriptions. We have more MRI scans. Costs will go up, not down. Why don't we ask one of our experts there, the Cato Institute, Michael, what do you think about that? Is it a given that if we insure everyone, healthcare costs will go down? Michael?
Absolutely not. There's no country that's ever expanded health insurance coverage and seen costs go down. What President Obama, what Jonathan are talking about is a healthcare reform plan that would increase healthcare spending by about $1.7 trillion over the next 10 years.
All right,
now,
guys.
if we already have, as the left says, the most inefficient healthcare sector in the world, why are they asking us to pump more money into it? If it's so inefficient, we shouldn't have to spend more money on healthcare. We should be able to provide healthcare to everyone if that's what they want to do without increasing healthcare spending at all, but they want you to pay higher taxes in order to pay for this
reform. We've got to wrap it here.
reform.
Rebecca, is it fair to say, though, that now that this is touching the middle class, something's going to change here? It's fair. I mean, once that, with a tipping point in our culture is when it gets out of the lower class and moves to the middle
Well,
class.
and especially when it's just spilling over throughout the country. It's not just in North Carolina. This is an issue that the whole country is facing and generations will continue to face. Obviously, a conversation we'll continue to have. Jonathan, Michael, thanks for being with us tonight.